Hey everybody, this is Kelly Gregory with Missouri Institute of Mental Health, and today I am joined by Dr. Roger Somi. Hi Roger, how are you doing today?
I'm great. How you doing?
Pretty good. We have a program coming up, and I was wondering if you could tell us a little bit about yourself, and then we'll talk a little bit about the program.
Yeah, I'm Roger Somi, as Kelly said. I am a psychiatric pharmacist by training. I am a professor at the UMKC School of Pharmacy in Kansas City, and I'm also the associate dean for our program on the campus at MU, which is where I'm dialing in from today. And my new job is pharmacy consultant for the Department of Mental Health.
Wow. So that's very new then, isn't it?
Yeah, I surprised you on that one, didn't
Yeah,
I?
you did. I did not know about that. So is that like in perpetuity, or what's your situation there?
Well, at least for a few years.
Oh, okay. I didn't know if it was like an annual kind of thing or something like that, but
yeah, no, it'll be for a few years. Working with the department to sort of manage the pharmacy contract and all things pharmacy within the State Department of Mental Health.
Now you've been with the university for how many years now?
35. Started when I was 12.
I was going to say you started at 2 or something, because I wouldn't think that you were over 40 at this point. But so 35 years, and I know that you and I have known each other for many, many years, working on programs around the state to train folks. And the one that we have coming up soon here is Common Clinical Issues, Updates and Questions about Psychiatric Medications. And that's the one we're going to have on December 9th. Right. And do you want to tell us a little bit about how that's going to shape up for people?
Yeah, so over the years, we've done a lot of these programs, these day-long programs, half-day programs called Psychiatric Made Simple. And so this is sort of an update to that. It covers a lot of the same topics, but more in a case discussion format. I'll throw some cases out there, and we use technology to get some questions answered, and so we will cover lots of different topics that folks who work with mentally ill patients will find interesting, I hope. As you know, I like to add a little humor now and then. I have a very dry sense of humor, so my goal really is to just keep people awake for 4 hours, and that's going to be the biggest challenge. But we'll talk about all the commonly used drugs, as well as some new things coming down the pike.
So yeah, we've done a program with you for many years called Psychiatric Made Simple. And so it's similar to that program, but you're going to have the case studies, I think, is kind of one of the major differences, or what else?
So one of the major differences, and we're going to focus a little more, the old Psychiatric Made Simple went through a lot of stuff, a lot of more science-based stuff like pharmacology, and we'll touch a little bit on that, but not nearly as much as we used to do from that standpoint. Yeah, talk about how we use drugs in patients, and why we use drugs in patients, and what happens when we do.
Well, thank you very much, Dr. Somi, for taking some time with us today. Hopefully folks can join us on the 9th of December for Common Clinical Issues, Updates and Questions about Psychiatric Medications. Thank you very much, and we'll see you all soon.